So, good evening, everyone. It's a great pleasure to welcome you all to the another episode of SLVA Web VetConnect webinar series. We are hosting every other week's Friday at 9 p.m. So today's we are going to have a very interesting topic on a small animal psychology, I would say, uh, done by one of our most well-known veterinarian on that field, Dr. Eranda Rajapaksha. And it's real pleasure to see so many of our veterinarians are also joining. So to welcome everyone, I cordially invite Dr. Sugat Pemachandra, President of the Sri Lanka Veterinary Association. Over to you, Dr. Sugat.
Thank you, Dr. Aditya, Secretary of Sri Lanka Veterinary Association. Good evening, dear respected speaker, Dr. Eranda Rajapaksha, our moderator, Dr. Dilucci, members of Sri Lanka Veterinary Association, and all the participants joining from Sri Lanka and around the world. It is my pleasure as the President of Sri Lanka Veterinary Association to welcome you all to another session of SLVA VetConnect webinar series. Today webinar, Psychopharmacology in small animals, addresses an important and rapidly evolving field in companion animal practice. As veterinary medicine continues to advance understanding animal behavior and appropriate use of psychopharmacological therapies has become increasingly important in improving the welfare of our patient and strengthening human-animal bond. I would like to express my sincere appreciation to our distinguished speaker, Dr. Eranda Rajapaksha, for generously sharing his experience and expertise with us this evening. We are privileged to have a clinician and academic of his caliber leading today's discussion. And also, I extend my gratitude to our moderator, Dr. Lakshika Dilruchi, for kindly accepting the responsibility of guiding this session. And I appreciate the SLV Executive Committee and the CPD organizing team for dedication to making this program possible. To all participants, I encourage you to actively engage in today's session. Please use this as an opportunity to ask questions, share your experience, and interact with our speaker. Thank you once again for joining us, and you all are warmly welcome to the today webinar. Thank you.
Thank you, Dr. Sugat. Okay, thank you, Dr. Sugat Pemachandra, for your opening remarks. Now I invite Dr. Lakshika Atampola, who is an executive committee member of the Sri Lanka Veterinary Association, as well as the live eye of this webinar series. She has taken all the pain in organizing this webinar and also volunteered to host this. I really appreciate your dedication on this regard. And now I cordially invite Dr. Lakshika Atampola to introduce the host and also explain the house rules regarding the webinar. Over to you, Dr. Lakshika.
Thank you very much, Dr. Udit. Good evening. It's my pleasure to introduce our resource person for today's CPD webinar, Dr. Eranda Rajapaksha. Dr. Eranda Rajapaksha is a veterinary surgeon, board-certified veterinary behaviorist, and animal welfare specialist with more than 20 years of experience in clinical practice, animal behavior, welfare science, and One Health research. He obtained his BVSc from the University of Peradeniya and later completed a Master of Science in Applied Animal Behavior and Animal Welfare at the University of Edinburgh. He subsequently completed advanced specialty training in a companion animal behavior and earned his PhD in animal biology from the University of California, Davis. He is a diplomate of both the American College of Veterinary Behaviorists and the American College of Animal Welfare, a distinction achieved by only a small number of veterinarians worldwide. His expertise spans behavioral medicine, psychopharmacology, animal welfare assessment, and the management of behavioral disorders in companion animals. Dr. Rajapaksha is the founder and the director of the Rover Veterinary Hospital. He has also served as a senior lecturer at the University of Eranda and held academic and research appointments at the University of California, Davis. Today, Dr. Rajapaksha will share his expertise on psychopharmacology in small animals, focusing on the practical use of behavioral medications in dogs and cats, their mechanism of action, indications, and their role within a comprehensive behavioral treatment plan. It's around 50 minutes lecture. So after the lecture, you can ask questions. So I warmly welcome Dr. Eranda Rajapaksha. Dear sir, the floor is yours now.
Okay, I hope everybody can hear me. All right. And I want to thank the President and the Honorary Secretary, EXCO, for inviting me for this talk. And I really appreciate Dr. Lakshika, who's being contacted me several times, trying to set up a time among all our busy schedules. So today, lecture we will discuss about veterinary psychopharmacology in small animals. So in this lecture, I want to focus several aspects. And before getting into the lecture, I want to show you, I did a pre-lecture survey among our veterinarians in the SLVA about their awareness and then their knowledge or their practical aspect on this veterinary behavior and psychopharmacology. Mainly because I wanted to formulate this lecture in a way that will match the audience. And also at the same time, I want to get an idea how we are doing. Okay. I'm trying to find. Okay, good. Now it's working. So these are the findings, and I will just minimize this one. Right. So then we had responses from veterinarian from all the sectors, small animal, mixed animal, and large animal practice, and also from academic institutions. And the good thing is, we see now 40% of them have said that they have had a formal training. That is mainly because of I believe, we have introduced behavior and welfare to our new veterinary curriculum. So the students and the ones have passed out the last 4 years, I think they are aware about this. And then many of them have said they have average knowledge on the subject. And the interesting part is, I'm very happy to see that they have mentioned, 40% of them have mentioned that they have identified these cases daily in their practices. And then most of them at least monthly, right? And this is a very interesting point to talk about, because behavior, when you really look at it, every day, every single day, you will see a case of behavior, because the moment you see an aggressive animal, right, it's a nature of animals to be aggressive that we know. But when they are aggressive, and then when you very commonly see highly aggressive animal in veterinary practice in Sri Lanka. So that's a problem. It's a problem behavior. So seeing it as a problem behavior is very important, because sometimes for our clients, they don't see some behavior problems as behavior problems. They think that they are good traits of dogs and cats. So having some knowledge in this area will definitely help you to educate our clients. And then among the treatment parts that our vets have tried so far, it's also again good that they have used environmental modification and behavior modification, mostly in trying to address these behavior problems they encounter, which is a very good thing, because quite often when our knowledge base is limited, we try to use medications, psychopharmacological agents, to resolve the problem without trying to do any behavior modification. So seeing this information was very interesting for me, and that means our pooled population that we have responses, they are doing quite well in addressing behavior problems. And then some of them have, very few have not treated them. Some of them have got trainers help, and then also quite a good percentage they have referred cases. And then also about prescription of understanding behavior problems and then diagnosing, they have mentioned that they are moderately confident about handling cases. And when it comes to psychopharmacology, they have mentioned, most of them have mentioned the knowledge is poor, and then they have found they have described psychopharmacology appropriately. And they also believe, the good thing is they believe that medication can be useful in treating behavior. So that idea of or the need to know about medications is indicated here, that I feel very good. And then among the people who have already used medications, it's interesting that we see gabapentin is used mostly, and then also fluoxetine is used. And then the one drug that I didn't provide in the survey, which is amitriptyline, quite a few people have used amitriptyline in their treatment procedures. And then also we have one person that have used larcaptil, which is chlorpromazine. It's more of a sedative drug, which has been used in the past a lot in behavior medications also, but now it's rarely used. We only use them to sedate animals, right? So this is the information that I have gathered. I'm very happy that you have responded. So it helped me how to pitch this presentation. And also I feel like with the knowledge base that we have, our veterinary community is doing quite well with the behavior cases. So just to provide, like, I mean, if you are looking for a simple definition kind of thing, so veterinary pharmacology is the study of medications used to alter the mood, emotional state, or reactivity of animals suffering from behavioral issues, anxiety, or cognitive dysfunction. So most of the time it combines, or all the time combines clinical pharmacology and the behavioral medicine together. It's heavily rely on understanding of the neurotransmitters, and basically this whole concept of psychopharmacology is based on understanding the changes of neurotransmitters and how we can alter them. So you will understand this more during the lecture. So in the lecture today, I'm going to focus on these key objectives. One is I want to briefly discuss about comparative neuroanatomy in humans, dogs, and cats, because as a second one, I want to discuss emotions. I think in this lecture, one key message that I want to take home is these aspects of emotions. Because if we are not willing to accept or willing to understand that animals have emotions, or they are capable of having emotions, we won't be able to understand most of what we are talking here. So that's the first thing that I'm going to establish. And then we will discuss briefly about some of the disorders, and then we will discuss about major psychotropic drugs, mechanisms, and some clinical uses. And then, when it comes to this comparative anatomy, it's very interesting. There's a lot of recent research within the last 10 years or so, or the 15 years or so. A lot of focus has been going on in this area because we are continuously fascinated, and also we are continuously trying to understand animal emotions. So in doing so, certain group of researchers, they are mainly focusing on brain structures, anatomy, and the brain mechanisms, the physiology. So humans, dogs, cats, and other mammals, we share an ancient evolutionary concept blueprint for emotional processing. Most structures of the emotional brain are structurally and functionally homologous across species. So there are big similarities among mammals. So one area is the limbic system. Emotional brain of animals is wired almost identically to humans, allowing them to experience rich emotional states. So this has been proven, and research is ongoing on this aspect. Then amygdala is the brain location where it involves in processing threats and acute panic. And also it's important in organizing our emotions and then providing signals for memory pathways. Then the prefrontal cortex is responsible for cognitive filtering and then making memories, and then help them in yielding impulsive, fear-driven choices, just like humans. And then this is a research that if someone want to go into more deep research and think about these animal emotions, I put this slide. There's very interesting research going in the world focusing on the similarities between human and animal brain, dog and animal brain, dog and human brain, sorry. So they have, like I said, they're sharing highly homologous structural centers. And then humans have a greater prefrontal cortical expansion. Dogs and cats rely more heavily on their subcortical emotional processing. So this study, they basically did based on MRI, functional MRI technology. And they looked at how animals respond to certain objects, and then they compared with humans. They found that same brain areas are getting activated in both species when they are subject to the same stimuli. And then one other person that I want to mention is this, I hope I'm pronouncing the name right, Jacques Panskep. And then there's a nice research, again, it's available online that you can read. The paper is on basic emotional circuits of mammalian brains. Do animals have effective lives? So in this paper, he reviews a lot of research highlighting emotions or affective states, emotional states of animals, and how we share about those mechanisms among mammals. And then in this one, the interesting part is he is describing 7 areas how we behave or how we physiologically adjust to the environment in 7 different categories. So one is seeking. So most foundational drive. So so exploration, curiosity, anticipation, finding food, seeking, or trying to survive is one of them. And it's driven by dopamine driven pathways. And then rage, aggression, defensive aggression, or offensive aggression. Again, that's another category. Then fear. Fear is another important aspect. Anxiety and avoidance system. It is mainly amygdala and the periaqueductal gray matter in the brain is the important areas in this aspect. Then reproductive behaviors. It governs innate and hormonal-driven sexual arousal and mating behaviors. Then care, nurturing for the young ones and for each other, empathy and parental protection, binding, and social grouping, they're all together. These are, again, brain and driven common functions. Then pain and grief is another one. And then play is the other one. So these are very, obviously we know about these categories, but sometimes, we don't tend to really comprehend or understand or agree that the animals could have similar emotional states given by these brain mechanisms. So that is one thing we all have to get into mind, that they also can have emotions. And humans, they can cognitively interpret and verbalize emotions most explicitly. We can talk and we can also use our body language, both, and then we can express our emotions and feelings. Dogs, cats, they express emotions through behavior, posturing, autonomic signs, and learn associations. So that's their, they can vocalize, but we are not highly capable of understanding their vocal signals, but we can be really good at understanding their body language. So that's because of that, they are expressing their emotions through behavior and posturing. Emotional state should be interpreted as neurobehavioral phenomena. It should not be a misbehavior. So now we are getting into normal behavior, because sometimes it's very easily we see our clients come and say that the animals are misbehaving, or they are hyperactive, they may be aggressive, they are destroying everything. So yes, of course, when you compare with the standard norm behaviors, they are misbehaviors. But as veterinarians, and also as advocates for clients, we should always explain them these are part of the whole behavior repertoire that animals are capable of. And also they are capable of expressing their emotions. And the only way or the best way that they can communicate with us is by doing these behaviors. So although we call them misbehaviors, but that could be a way of that animal expressing its feelings. So that's very important as veterinarians to first understand that, because then only you can ask questions and then try to find the reason why this animal is doing this. There are 2 main reasons. One could be a hardwired problem with genetical predisposition, and then issues with the neuromechanisms. It could be a mechanical thing. But the other component is the environment, which is mostly the case. In a lot of behavior problems that we see, environment plays a key role, which means the house and then the people involved. So when you really talk to the people, then you will find why this particular animal is behaving like that. And then one other thing is understanding the normal behavior of the animal is important, because some of these things that we call misbehaving, they could be normal behaviors for that particular animal at a particular age. So then when we move on to these pathological aspects, then there are certain sites in the brain that mainly get affected. So amygdala is one. It's a central hub for emotional appraisal, evaluates environmental sensory inputs for immediate threats and triggers, and rapid fear responses can be produced. So one thing is, when it comes to behavioral medicine in animals, fear is a big component. That so many animals that we deem as aggressive, they are being aggressive because they are fearful. They are feared of their environment. They have developed fear throughout their life time, and now they have found a way of responding or coping with that fear through aggression. So, so this area is very important. Then the locus coeruleus coordinates the systemic panic in animals. It fires norepinephrine throughout the cortex to prime survival-oriented attention. So panicking is mainly for survival. And then the animals become hypervigilant, and then they react. And then these are creating memories. And if animal get panicked for a certain stimuli or response or a person or a situation, that get recorded, and then memories are stored. And then the next time when they are even getting closer to getting exposed to that situation, they'll be panicking and showing behavioral issues. Then hippocampus, that's the part that consolidates cognitive context and memories. So this is the important part in for both humans and animals to organize our memories. And then whatever the fearful, frightening encounters, they get memorized, and then they can trigger anticipatory anxieties in animals. So this is developed. And in this pathological situation, the neurotransmitters are the key important thing that I mentioned at the beginning also. There are 4 different categories. There are 4 different neurotransmitters: serotonin, norepinephrine, dopamine, and GABA. So they each have main roles. Serotonin is important in mood, impulse control, and sensory gating. Then norepinephrine is important in vigilance, arousal, and fear responses. Dopamine is important in reward seeking, motivation, and motor activity. So this is when they are learning, when they're getting trained. It's a very important neurotransmitter. Then GABA is managing its inhibitory tone, calming, and anxiolysis is done with that neurotransmitter. So when it comes to neurotransmitters, so this image down here, it's basically, oops, second. Okay, I hope you can hear me. Hello?
Yes, yeah,
You can hear me, right? I think something went wrong. Okay, so in this second picture, the bottom, this synaptic cleft is the important part, because the amount of neurotransmitters that we manage, that is how we mostly manage our pharmacological agents in helping these animals. So many of the medications that we will talk about, they will be altering these neurotransmitters. So this picture is basically showing how these neurotransmitters can be changed in so many different ways. So drugs can inhibit the synthesis of the neurotransmitter, and drugs can stimulate receptors. It can stimulate autoreceptors that are attached to the main receptor. And also drugs can inhibit neurotransmitter breakdown so that the amount of neurotransmitters are preserved. You are basically, it's stopping the degradation. So the amount that stays in the synaptic cleft is increased. And drugs inhibit neurotransmitter reuptake into the cells again. And also it can totally inhibit autoreceptors, can stimulate postsynaptic receptors, and also they can serve as precursors. A drug can be a precursor so that the neurotransmitters get produced, and drug can prevent storage of the neurotransmitters. So all these mechanisms can be controlled by medications. So this specific article, Mechanism for Drug Action at Synapse, it's a very interesting one. If you read about it, it will give you a very clear idea how each and different medications provide the desired change. Again, I'm not going to go into a lot of detail because our main goal is the clinical aspects. So these, when these drugs are changing neurotransmitters, they can be one of two ways, or even both. They could be agonists, or they could be antagonists. They can, by both ways, it is basically trying to change the neurotransmitter amount in the synaptic area. By doing that, we can change the mechanisms in the brain. Fear, phobias, anxieties, we can address. So then moving on to practical aspects, important foundations for psychopharmacology is you have to always understand it's a multimodal approach. Psychotropic medications are not a standalone fix. I really want you to get this into your head. Just giving a medication to an animal is not going to solve the problem when it comes to behavioral problems. So it has to be, they act as critical catalyst, altering the neural physiological to lower anxiety threshold. So it can reduce the anxiety levels in animals, and it will provide a window of learning for the animal. So the animal that is very scared and fearful, they can't concentrate. So the medications are helping them to have this calm window so that they can learn. So the learning part has to be done through behavior modification and training. So you have to always explain it to your client also. There are no quick fixes with medications. So I'm mentioning this at the very beginning because you can always easily do this mistake. You can just give a prescription after getting a history and then think that the problem will resolve. It won't happen like that. And also the other important thing is you have to always rule out diagnostics first. You know, the animal could be having a different medical problem that you are seeing as a, or the client is seeing as a behavior problem, right? It's quite common because, for example, animals, when they are sick, they don't eat. That's a change in behavior. When they have a problem, they start limping, you know. That's not a, that you are seeing a behavior like that, but it's not a purely a behavior problem. The owner might come and tell you, okay, this animal is circling, going round and round, round all the time. So this could be a behavior problem also. It could be a compulsive behavior, or it could be a problem in the brain, where there's a problem. It could be a vestibular disease, or it could be a problem in the central brain centers. So all these are possibilities. So sometimes owners might come and say, this animal is leaking all the time. And then it could be a dermatological issue, not a standalone behavior problem. So you have to always do your diagnostics and make sure that you check for other differentials, check for medical conditions. And then if we are not seeing any indications for a medical problem, then you can think about behavior issues. So chronic pain, gastrointestinal issue, dermatological lesion, endocrinopathies, subclinical neurological diseases, all these can present as behavior problems. And then in this scenario, so these different neurotransmitters that I have mentioned, they are very important. Serotonin, norepinephrine, dopamine, GABA, glutamate, and acetylcholine. And they are responsible for different parts of activating in the brain. And then, and we also have here, I have also listed the different clinical conditions that each neurotransmitter can be responsible for. For example, serotonin, it's a common neurotransmitter that is in the case of anxiety and separation anxiety and OCD patients, right? Like that way. I'm not going to spend a lot of time in this slide because I think I need to manage my time. So one important thing to remember is the duration of treatments that we are going to use. There are two categories, long-term therapy and situational therapies. So in this long-term maintenance, the goal is to shift daily neurochemical balance of the to systematically elevate the baseline threshold of the activity. So we are trying to we are trying to shift daily the neurochemical balance to a certain threshold. This can be done by rigid daily dosing. So missing a dose can compromise the clinical efficacy of the drug. So these particular drugs, if you are giving to animals, then you have to daily administer it. Sometimes it needs long-term medication, right? And then short-term situational drugs, here the goal is targeted to intervene or reduce acute predictable environmental stressor. So in this particular case, like now you have animal who is getting too excited to go to the veterinary office, or the animal is excited when traveling. So in certain specific scenarios, you can give the short-term medications and find a relief. Animals who are having thunderstorm phobias or sound phobias. So before the event happens, you can give a medication and then you can control the problem during a short duration of time. So administer strictly as needed prior to the scheduled trigger event. And its clinical onset is rapid, typically achieving targeted anxiolysis within 30 to 90 minutes. So these are the two categories of medications. And we'll go into specific ones. So long-term ones. So selective serotonin reuptake inhibitors. So these are the one common long-term medication that we use in behavioral pharmacology. It's a gold standard in managing generalized anxiety, separation distress, and repetitive compulsive habits in both canine and feline patients. So therapeutic onset, it is delayed. It takes some time for that drug to have an effect. So 4 to 6 weeks is required. So you have to inform this to the client. You can't expect a result within 2-3 days. You have to give the medication for more than 4 weeks. Then we can anticipate for changes. And then there are in USA there are approved drugs for this. And then For feline, it's not like registered or approved medication. It's highly effective off-label. So both cats and dogs, you can use this. In Sri Lanka, we have this medication, and obviously we don't have major registering process for drugs for animals versus humans. So we can use the human preparations, and I have used it in cases. Only thing is you have to explain it to the client that we are using a human medication that has the same effects, and we are using the right application for the animals. Then the second one is tricyclic antidepressants. It is a long-term medication again. It has it is a dual reuptake inhibitor. It has more effect or more active action than the tricyclic antidepressant, selective serotonin inhibitor. So this one, it blocks both 5-HT pathway and the norepinephrine pathway. So this one have anti-anxiety properties and also antihistamine properties. So example drugs are clomipramine and amitriptyline. Amitriptyline is a commonly available drug that we prescribe in Sri Lanka. So this will give you certain level of antihistaminic effects also. And only thing is side effects, they have a broader side effect profile than SSRIs. And then it's due to concurrent blockage of histaminic and cholinergic receptors. They will have certain side effects like dry mouth, urinary retention, and cardiac changes in certain cases. So you have to again inform the client these are possible effects purely because of the medication. Then monoamine oxidase inhibitors. So salicylic is a common drug. It's available in Sri Lanka also. And this is mainly used for a specific behavior problem in older animals, cognitive dysfunction syndrome or CDS. So there's an article that I have also written on this aspect. And this one, basically when animals get older, their activity in the brain can change, and they can get similar conditions like what humans are getting, like dementia. So I'm not going to deeply talk about the behavior problem, but when this happens, animals, they start changing their regular behavior patterns. Their sleep-wake cycles will shift, and then they will start showing some repetitive behaviors. Their elimination behaviors will change, and this can become a problem. So when this become a problem, the one answer that we can give is this medication. So it inhibits monoamine oxidase B, and selectively perceiving synaptic dopamine concentrations. It is increasing the dopamine level so that the animals get into a state of happiness, and they become active. And when you give the medication, they will be active during the day, and they can sleep in the night. And one important thing is this medication, you have to be very careful. You can't combine this medication with any of the previous two medications that I mentioned. I will specifically explain it later. So, so this is a medication. They are coming under aciperon group, buspirone, and this is mainly specifically for commonly used for cats when cats have this behavior problem, urine marking. I will discuss example as we go on. And then the short-term ones, these are the list of short-term medications that we can use. Benzodiazepines, we are quite familiar. They are fast GABA boosters. They are used during sudden onset of storm phobias, fireworks, before traveling, right? The only problem here is sometimes these benzodiazepines, they can reduce the disinhibition for aggression. So sometimes animals could become aggressive when they are on this medication. And then also a certain population of animals can show paradoxical excitement. That means, we are giving the drug to calm the animal, but some of the animals, they will be more excited after getting the drug. So that's also a problem with that. Then also clonidine is another alpha-2 agonist that we can use. Can be used for manage for fear, panic reactions, and behavior arousal. And trazodone is a relatively new drug. It's called a mixed SARI, serotonin antagonist and reuptake inhibitor. It rapidly controls situational anxieties such as post-operative confinement, travel, and veterinary hospital visits. So as far as I know, I don't think we have trazodone available in Sri Lanka, but this is a very effective drug for veterinarians, especially with the vets who are difficult at the hospital. Then there are other quick-acting oral gels, dexmedetomidine gel, that can help with animals with noise phobias. Then gabapentin is one that we are all familiar with, and I feel like we are appropriately using it, and we are using it a lot now. And it has multiple advantages. It can be used as a pain medication also, right? But it can also be used as a calming aid for dogs and cats if given 92 minutes to 2 hours prior to veterinary exams or long traveling. And then just a small matrix. I will share this presentation with you after the talk. So this is mainly for information. So these are the different behavior problems, and then the recommended classes of medications, and then what are the available brands and medications, and then the dosing strategies. So you can see fear and generalized anxiety. You can use SSRIs or TCAs. And then it's a daily chronic management protocol. In acute phobias, benzodiazepines, situational. Aggression, you can, and compulsive behaviors, you can use selective serotonin reuptake inhibitors. Fluoxetine is a choice in Sri Lanka. Again, a daily dosing is required, slow onset. And then for urine spraying, you can use both fluoxetine and acetylbutyperon. It's a daily therapy. Then for cognitive dysfunction, you can use selegiline. It's a daily therapy. So the important one that I want to mention, what I told you earlier, is this serotonin syndrome. So serotonin syndrome, it's called a co-toxidrome. It's a life-threatening emergency. So this is where we can go really wrong with behavior. This is one area where we can go really wrong with behavioral psychopharmacology. So the animals who are given SSRIs or MAOIs together, they can develop this. So monoamine oxidase inhibitors, you have to be very careful when you are starting that medication. You have to get a clear history, and you have to ask if this animal has been on any of the other psychopharmacological medications, especially SSRIs and tricyclic antidepressants. So these are the signs. You can see they can get acute agitation, severe confusion, and then they will have profound hypothermia, tachycardia, salivation, and they can have neuromuscular dysregulation, and animals can die very quickly if this problem happens. And the common mixtures are giving selective serotonin reuptake inhibitors and MAOIs, Also, tramadol is another one. So tramadol is a medication that we commonly use. So if your patient is on a SSRI, you don't use tramadol because it can lead to this syndrome, right? And trazodone is another one. And the St. John wort is a herbal product. I don't think it's available in Sri Lanka, but who knows, people may be importing them. So you have to be very careful about this. And if that happens, you have to remove the cause, remove medications immediately, and then you have to give supportive therapy, IV fluids, right? And there's one antidote. You can use ciprofloxacin to reduce the 5-HT as a 5-HT agonist. So you can reduce the serotonin, histamine effects by giving that. So you have to be very careful in prescriptions and follow up with these patients. If you are starting an animal with any of these psychopharmacological medications, you have to be very careful. You have to have a good communication with the client so that these mistakes will not happen. And also always have a reporting mechanism so any other veterinarian can also know what medications are this animal is on. And then if you want to change medications, there are washout periods. So these are different time durations from how that you have to take before switching from one thing to the other, right? So if you are if the animal is on fluoxetine and you are going to switch to a amitriptyline, then you have to wait for 4 to 6 weeks, right? And if you are switching into a selegiline or you're introducing selegiline to this animal, you have to wait 5 to 6 weeks after stopping the previous medication, right? So these are very important points. It's a lot of information, I know, but think about this. So you can't simply just change it as you like. You have to have these proper washout periods before you change any medication. And then also, if you want to stop the medication, you have to taper it off. So there are different ways that you can taper it off. One is you can do 25 decrements, reduce daily dose by 25% sequentially every 2 weeks, and then transition to alternate day 25 dosing on week 7, 8 before complete cessation. Then the other one is alternate day steps. You can cut dose by 50% for a week 1 and 2, then shift administering that 50 dose strictly over every other day on the 3rd and the 4th week. And then you go on like that and you stop. The important thing is you have to monitor the dynamics. When you start tapering it off, you have to observe the animal's behavior. So it's very important to have this follow-up mechanism with your client. And doing a behavior case with medication is some trouble. I mean, it involves a lot of your time. You have to be available for the client and you have to have a mechanism of communication with the client, because even the simplest change in behavior and then what message that you're getting from the client could be important. So if the animal is going back to the behavior and then if there's a relapse, then you have to immediately return to the last effective dose and continue. Otherwise, all the work that you have done for several months is gone. So it's a long process. And in Western countries, usually you have your primary appointments and then you have your follow-ups. And also you have a charged communication session for a longer period of time, because you are spending time with your patients, you are spending time addressing the case. So you have to explain it to the client, and then you also have to have a mechanism that you let the client that this involves some financial charges. And then also it's very important to give clients the information about the treatment plan, because otherwise they will accept or they will anticipate quick solutions. So in this particular case, you have to write them down and tell them there's adjustment phase, the first few weeks, then there'll be stages that animals will go up and down with the problem, and then there'll be a steady state. So you have to inform this to the client. Right. And actually, this is where I wanted to finish the presentation. Actually, I have a couple of quick cases to discuss. Can I take some time and explain them? Is that okay?
Yes, Dr. Eranda, you have time, yes.
Yes, yeah. So give me a quick few minutes because so now major behavior problems in pets you can categorize. There are three main ones. Separation anxieties or generalized anxieties, urine spraying in cats, and then noise phobias and aversion. So out of these, I will quickly discuss one case for dogs and one case for cats. Purely mainly because to explain why these dual mechanisms are important, right? So you have to first understand the clinical diagnosis through your clinical signs and history taking. So animal who is having separation anxiety, they will show certain signs. You set up an appointment, it'll take like half an hour, maybe 45 minutes. And you ask a lot of questions from the owner and then try to understand the problem. So distress sign often manifests in highly intense bursts during early departure in hours. So when the owner is departing, that the animal is frantically barking or destroying things in the house. And they might eliminate, they might urinate, defecate, they might drool. Sometimes they might even vomit. And they will have heavy panting and so many signs that they are highly stressed when the owner is leaving or right after the owner has left. So when this problem is setting up, when this problem is happening or beginning with a dog, you will see some of these subtle early cues. They will be anxious while they are kept alone, right? They will not eat high-value treats. They will skip meals until the owner returns, right? And also they will have these shadowing tendencies that they will keep on following the owner all the time right before they leave. And sometimes they can even bite themselves, or they can walk, or they can paw on the floor and they can bleed their paws, have broken nails, have raw muscles. They can even sustain these type of injuries due to this condition. So it's a problem. So what you do is you assess them and you identify the behavioral timeline, when it's happening and at what time. Usually separation anxiety spikes less than 30 minutes after the owner leaves. If it is happening after 2-3 hours, it's mostly that the animal is doing whatever the destruction based on boredom. It's not separation anxiety per se. So then the departure triggers, you try to understand what triggers that the animal is getting anxious. And then you identify those triggers, and then you try to desensitize the animal those triggers. For example, getting up, wearing shoes and picking up the keys is the signs that the animal is getting excited. You do it every day. You do it on a weekend that you are staying home. You do it several times so that the animal understand. Just by going through those situations, the owner is not going to leave. So that will really help the animal to desensitize those emotions. And also when you are reunioning, when you're coming back home, you have to give them instruction, don't overplay it, right? Don't greet them for a long time. It's like, we are rewarding them for being anxious, So you just ignore them for the first few minutes, and then you start gradual interactions with the animal, right? And also you have to check other medical problems that the animal may be having. And then you follow a good behavior modification plan for a good time period. One thing is, initially you have to avoid your absences. You try to be there for the animal, or if you have to leave, you find a place with another person so that the animal can, so because more they get anxious, that the behavior will persist for longer time. Then you identify the triggers and desensitization is done, and then you train graduated departures so that the animal will not be panicking. And pharmacotherapy is tricyclic antidepressants, so that are the most common medication. If that doesn't work, you can go with fluoxetine. And also you can use situational anti-anxiety medications right before you have the departures. And this is the important part. When you do behavior modification and daily medication, the success rate is very high, 90% success rate. And then just by behavior modification, you can reach like around 50% success, but the best is achieved by two-pronged method where you get both medication and the behavior modification. Daily medication only have a very low success rate, and then it can quickly trigger back to the level once the medications are removed. And these are the medications I mentioned that you can use for separation anxiety. And then the other one is the common one in cats. It's urine marking. So basically what happens is they spray. It's a normal behavior for cats. They do this for to mark their territories, and also it is done based on the anxiety that they have. They typically stand up and they urinate on upright surfaces, right? They will hold their tail up, and then you can see small horizontal streams of urine. And this is a big problem. I have had cases that owners complaining the cat will come and spray on their clothes, their kitchen utensils, specific areas that the owners is sitting. So they will have, they will do that. Sometimes they will do it right at the door or at the window where they can see the outside cats. So these triggers are very important. Having multiple cats in the house is one reason. When they have problems with themselves, they will do this behavior. When there are outside cats moving around, then this can happen, right? So unfamiliar objects, new people coming into the house, new changes, all these can instigate this problem. So again, you take first you do your medical exclusions, because when it comes to urine issues with cats, you have to always think about medical problems before you go into think about behavior issues. You do your medical screening, look for lower urinary tract diseases, do all that, and if there's nothing can be found, and then you get a detailed history, and then if the problem matches with the what the owner is saying with the history, then you can think about behavioral problems, right? You ask about the posture, how animal is doing. Posture is a key important aspect to diagnose this. Then also you question about intercat dynamics in the house. And also it's always good to have a resource map. Where do they get fed? Where do they have enough litter boxes in the house? How they share the space in the house? If it's a multi-cat household, all these informations will be important. And the behavior modification involves, you giving them resources. If when it comes to litter boxes, we say number of cats plus one litter box. You add another litter box into the house. So that will help them if it is related to a litter box usage, and if it is a competition issue, right? And also you can have visual barriers to obstruct other cats coming into the area, and also this one seeing other outside cats. Also, you can do things to neutralize the scent in the house. There are different ways that you can do. You have to first clean whatever the urine, because as long as urine smell is there, cats will keep on urinating. And then you deploy, there's a synthetic feline facial pheromone available. It's available in Sri Lanka also. You can get it down from online sites. so that diffusers will help to calm these animals down. And when it comes to, again, behavior modification and environmental modification is very important. That gives you the high success rate. And also spray, if you have an animal who is spraying, one of the first things to do is to castrate the animal if the animal is intact. That can resolve a good percentage of cases, because spraying is a behavior that is associated with males, and it's associated with their male hormones also, because they do this territorial marking more or react more when they have their testicles intact. So the medications you can use is fluoxetine, amitriptyline, and buspirone. So you can select which would be the best possible one for your animal. And then most of the time, fluoxetine is a good one to start with in Sri Lanka. And then first you try castration, and then also you try behavior modification, environmental modification. And then when you have addressed those, then you start with your medications. That will really help, because the owners has to understand just giving a medication will not help. So here the key takeaways is medication is only half the battle. Successful veterinary behavior modification requires. We can have another lecture, or we can have another discussion about different behavior problems in the future. And you have to have structured training protocols with accurate psychopharmacological intervention. So also understand about the medications and explain it to the owners, the extra labor use, that you are using human medications. And then safety and monitoring is very important. When you are giving these medications, it's ideal you check their blood profile, serum biochemistry before you start. That will help you give you a good starting point. And then every 3 months, and also later into time, every 6 months, you should check the serum biochemistry levels, as they can, long-term medications can impact liver and kidney functions. All right, thank you so much. And I took more than the time I anticipated, but I hope I covered what I want to, gave you you got the message that I want to convey. Thank you.
Thank you very much, sir. Within a short period of time, I think you tried your best to give a lot of things to us. So you can ask questions. We can give 5 to 10 minutes. Is there any question you can ask from?
Dear Dr. Eranda.
Yes.
Hello. Yeah. I have some cases on cat. All the cats are licking their backside. That symmetrical hair drop from the both sides of the cat. So what will be the condition for that?
Yes, very good. So we have seen also quite a few cases like this. So most of the time, what we have identified is now these animals who have this triangular shape alopecia, because they have kept on leaking. So
Yeah.
one reason is they are constipated. When we take X-rays, they are severely constipated cats. So when you address that, that can resolve the problem. Okay. So that's one category. So it's a medical, more of a medical related problem. And also if they have any urinary tract infections, also they do this because of the pain associated with that area, they will leak. But I have seen several other cases. It's more of a psychogenic alopecia type of cases when we address the constipation, and sometimes they don't have constipation, but they keep on licking it. So this is a problem with this dopaminergic pathway, and then they enjoy doing that behavior. So these are compulsive behaviors. So in these particular cases, what you need to do is you try to avoid them doing the behavior, right? It's very difficult with cats because cats have a typical grooming cycle. They have to groom 40% of their time. So if you stop them doing it by some mechanical way, like by putting a t-shirt or by putting a collar or something, the moment you take it off, they will go back to the behavior. So it's very difficult to avoid these things. So what you can do is give medication. Medications can help. Using a drug like fluoxetine, amitriptyline, they both can help with these conditions. And then do a lot of environmental enrichment. Have enough play possibilities and enrichment in the house so that they don't have to spend licking all the time. And also, there are a couple of cases that we have addressed. We have used this Kohombatel and bitter apple application. So when it's bitter, they stop licking it off. So those also works. But first look for this constipation and any other medical issues associated with the hind region.
Thank you, Dr. And thank you.
Dr. Janit Gunasekara.
Yeah, thank you, Eranda. It's a wonderful presentation, and it's very comprehensive, and you can't escape from me. So I want to ask one question, one big question. Do small animal or any animals have mind? So why you always call the behavior? And when you come to this presentation, you started the word with psychopharmacology. Psych means mind. So we are trying to escape from the mind part, and you are explaining everything in the behavioral form. So do animals have mind really, or what's your explanation for that?
Yeah, I mean, this is an interesting area. So again, this use of words, this I agree with you. Like using this word psychopharmacology is it's difficult to justify. So this word psychiatry also is the same. So I think we use the term from the psychiatry where you have the ability to prescribe medications, and it was combined into veterinary psychopharmacology. So when it comes to this theory of mind, it's a very interesting subject area. There is a lot of research going on. People try to understand, do animals have a mind, or this theory of mind? Can they do certain tasks thinking by themselves? Can they resolve problems? So for example, there's a lot of mirror imaging studies that they have done with so many different animal species, trying to understand, can they recognize themselves in a mirror? So there are some animals who can do that. And at the same time, with primate research, they have done a number of research trying to, and have found that animals can think and then do certain things for themselves. And not only for themselves, they can do certain things for their conspecific friend in the vicinity. So they also can have the ability to use tools. So these are some of the experiments that have proven that they have this theory of mind, and they have the ability to think for themselves and also for their conspecifics, and then make actions. But the research is still going on, and then there's no right answer whether they have a mind or not. But I think
when I studying psychology in 2000, and I was given a target to do something on animal psychology. So I was trying to read a lot of stuff, but I couldn't find anything on psychology, animal psychology. Then I found certain books on animal psychology. All are from the eastern part of the world, not from the western part of the world. So I found some books from India and China and certain Asian countries. They clearly explain its mind and its psychology, animal psychology. But when it goes to Europe and the western part, the US, they always take the word behavior. So I feel my personal understanding, animals also should have mind. Even our mind, nobody can trace our mind. We think that we have a mind, and because we are using the similar the medication what humans use. So if we have brain, if animals have brain, and if we are using the similar medication, if they are then if you are giving animals also similar medication, they also should have mind, I suppose. The only thing you are very careful. I'm not criticizing any fraction, but Western part is very careful about not mentioning the mind part in animals. They always call it behavior. So when you study further, I think there's a mind part as well. That's why we use with psychology when it comes to emotions or any other expression, certain anxiety. So those are to do with the mind, not the behavior. So when certain emotional or the mind part is working, the outcome is the behavior. So even humans, if person has OCD, it's something to do with the mind. But when you modify with certain medication, you correct the behavior. So what you see from outside is the behavior. So you can't say any humans are having behavioral disorders, but it's really a psychological disorder.
Yeah, and actually, if you take this Buddha's preachings, as we know, like he has mentioned about this animal, how animals can be mindful and how they can achieve the same states as humans. And also this, if you can remember the list that I showed, this rage and searching and all these things again,
sadness.
Everything is already mentioned in our religion so many years back. But now we are seeing in modern psychological literature. Yes, I mean, it's a matter of how
Are you trying to do something to find out certain aspects of the Eastern cultures and the Eastern psychological aspects? Because I think your study is confined to the Western part. And is there any idea of studying, or is anybody in this forum interested in studying animal psychology as per?
I mean, I have not actually embarked on any of these aspect where the intelligence and then the neuromechanisms are concerned. I have not concentrated any of my research in that, but I have done this one study on addictive behaviors where we have studied certain plants, and then we have studied the effects of cupomania, comparing with catnip. And it's also interesting, the cats in America also respond to cupomania plant, and then the cats in Sri Lanka also respond to catnip plant, which is present in USA. So, and the behavior is a very interesting behavior. It's like, they are going into the state of highness, and then they enjoy it, and it's a short-lived behavior, and then after that they recover. And yeah, it's very interesting, these areas to study. Yes.
Yeah, I'm requesting the participants, the young crowd really, to get into this subject, because I felt from the beginning. So we are missing a lot. We think a lot of almost all conditions are medical. So if you really carefully assess the condition, you see some psychological part as well with each condition. And when you treat also animal, especially with appointments, strictly with appointments, you can see the animals are very calm down and they show their psychological what call status is very neutral. So versus the very busy and compacted sort of hospitals or clinics. So I observed that. So it's good area to study. And anyway, I feel we should do a workshop or something, not one day, few workshops. I think SLVA president Dr. Sugat and the rest would organize something like that. It's good area to discuss. This one now is not enough anyway. So I can give my inputs also, because it's mainly on human psychology, but a lot of things are similar and we can share certain things. So drugs are also similar. And I have tried long back I had tried kind of psychotherapy, not without medication. So it went very well and treated very well without any medication. It's only change in the environment and the cognitive part. And I have tried using certain drugs as well. That's also answered well, but unfortunately I couldn't present these to the SLVA or somewhere to our profession. So young people should start something on this psychological thing, and yeah, it's a good start if somebody is doing that. Thank you, Eranda, for very wonderful, and this is really a eye opener, and yeah, it's really interesting. Thank you.
Thank you. Yep.
Dr. Lakshika,
Yeah.
you are muted.
Can't you hear me now?
Yes, we can hear you.
So, can we wind up this? So, are there any questions more?
No one is asking, so you can do a vote of thanks, no?
Yeah. And thank you very much, sir. It was a very nice session, I think. We got a good experience, and within a short period of time, you tried your best to give a lot of things to us. So it is a good experience for all of us, and I think we can arrange some more sessions. So we'll discuss about that. And thank you very much for Dr. Janit Gunasekar also. So thank you very much, Dr. Eranda Rajapaksha.
Thank you very much. And also I want to say that this is my first presentation that I did in AI. This was completely done using AI. So you may have seen some mistakes. I found some mistakes. So yeah, that was very interesting exercise. Thank you so much. Yeah, for letting me have the talk. Thank you.
Thank you. Thank you very much, Dr. Eranda and everyone. Thank you very much. Good night.
Good night.